Hey guys, welcome to Dr. G Medical Examiner.
According to the investigators' report, Eric Brody had arrived in Orlando a week earlier for a marketing convention feeling great. But shortly after checking into his hotel, he begins to develop a minor backache.
He gets here and he tells his friends that he kind of pulled his muscle and really wasn't feeling well and had to stay in bed. And so he stays in bed and doesn't even go to the convention the first day. He calls his doctor back home, and his doctor told him to take some acetaminophen, an anti-inflammatory, over-the-counter medication, and maybe that would help.
But it doesn't. Eric, usually active and healthy, is confined to his hotel bed for 2 more days. His colleague Sarah continues to keep daily tabs on his condition.
She calls up the next day, but lo and behold, this time, EMS answers his cell phone.
According to the paramedic, Eric had called 911 minutes earlier, and they were now on their way to the ER.
And they tell her, he's not doing very well. You better meet us at the hospital.
Dr. G discovers a notation in the investigator's report. A curious piece of information the investigator learned from Eric's wife, Angela.
She said it was something really odd happened several weeks ago, and that they both had spider bites. His spider bite was kind of on his back, she said. And he was complaining of back pain. Hers cleared and his cleared. They'd gotten supposedly some antibiotics, and they didn't think much of it.
This show uses actors, so the autopsies are not real.
I don't see any evidence of a spider bite.
Dr. G examines the skin more closely. She can tell right away that it's mottled or blotchy.
People who are real sick often will get this mottled appearance. The lividity goes all over, and you get this kind of mottled, sick looking. And he had that, which really made me think maybe he's got meningitis.
Meninges looked normal.
It looked really clear to me. We took some fluid, but it looked normal.
Abdominal organs look normal.
He's got some kind of exudative material on the surface of his lungs bilaterally. His lungs look sick. At this point, his heart looks pretty good. I mean, it's an okay size. His liver looks good. His spleen was okay. Bowels. And there we have big trouble. There's a terrible infection. He's got an abscess in the area of his psoas muscle.
The psoas muscle is a long, powerful muscle that runs along the spine of the lower back and down into the thigh. It supports the body and enables it to bend and flex at the waist.
I gotta tell you, it kind of looks like a pork tenderloin or like a beef tenderloin. That's what it looks like, kind of a bundle of muscle.
It's MRSA.
2 days later, Dr. G gets the phone call from the lab, and she's intrigued by what they tell her.
And I was really surprised at what the lab told me he had. He has MRSA.
Methicillin-resistant Staph aureus, or MRSA, is a highly resistant form of a staph infection. Staph is a common bacterium found in the nasal passages and sometimes on the skin.
MRSA has been called the perfect human pathogen. It's readily spread from person to person, so a lot of people are just carrying MRSA around in their nose or maybe on their hands, and they're not very impacted by it.
Enter the body through a break in the skin or inhalation. As a misdiagnosed spider bite.
The interesting thing about the story on him is that his wife and him were convinced they have spider bites.
But what Eric and his wife thought were spider bites were actually localized MRSA skin infections, a common but potentially dangerous and frequent misdiagnosis. In the case of Angela, Eric's wife, Her immune system was able to fight off the infection, but unfortunately, his wasn't.
That bacteria got into his blood. And a lot of times that's a very insignificant thing. A lot of times even brushing your teeth, you can get bacteria in your blood, and that's fine. But probably what's happened is he either maybe had a strain, maybe he did hurt his muscle, he strained his muscle, and the bacteria settled there when it went through his blood.
It's 4 p.m. on Wednesday, and Eric Brody has been confined to his hotel bed for 2 days with terrible back pain. Little does he know that his pain is due to a massive MRSA infection that has invaded his body through a cut or scratch on his back and then festered in his psoas muscle.
It's a very invasive bacteria. It settled there, and then it started to grow.
The infection eventually spreads through the bloodstream to other vital organs, such as his lungs, causing severe pneumonia.
This infection is growing bigger and bigger, and eventually he gets sepsis, where that bacteria starts multiplying in his blood.
Finally, Eric realizes that something is terribly wrong and calls for help.
He waited till his last breath to call 911.
But the call is too late. The infection has already set off a catastrophic reaction in Eric's vascular system.
Blood vessels to kind of lose their integrity and dilate, and he just can't maintain blood to his vital organs anymore.
Blood flow to Eric's brain and heart becomes drastically reduced, and he goes into shock.
Thank you for watching. Like, comment, and subscribe. Hit the notification bell to know when I post a video, and I will see you next time. Bye.